Um, and I just want to welcome everybody to our Health Workforce Council quarterly meeting. This is our second council meeting for the Health Workforce Council, and we're happy to have you all here with us today. You can go to the next slide, please. So we're like to just do introductions via the chat. So if you can enter into the chat your name, job title, organization, and any interests or projects you're currently working on in health workforce, or things you're participating in. If you just want to share kind of your own announcements, so to speak, in the chat, that would be great. And we'll quickly go over our agenda. So you can go to the next slide, please. So we're doing a very brief welcome today for the sake of time instead of doing roundtable introductions. We are waiting for Josh to join us. He's going to do a report out on the 2022 State of the Workforce in Healthcare Changes and Challenges. This was presented at the HIP Annual Community Forum. However, that content was so rich that we really wanted to invite him back to do even a deeper dive and give him some more time. So he's going to present with us for about 20 minutes on this topic. And it was super interesting, so I'm really excited to hear it all over again. And then we have a professor from UC Santa Cruz who's going to share with us new updates on their global and community health BA and BS programs. And Your Futures Our Business Executive Director is going to share about their work-based learning and career exploration programs. Then we'll have a little brief time to share out on what our Health Workforce Council work groups have been up to for the last quarter. And we want to spend some time with an open discussion at the end around our theme of the day, which is how do we support work-based learning and what current infrastructure is supporting work-based learning in clinics and hospitals. And then we'll just do a brief closeout with more information about our upcoming quarterly Health Workforce Council meeting and some information on how to register for that. So I'm still stalling for time because I don't see Josh in our meeting. We could switch, I think. Oh, he's just finishing up a call. We'll jump on in 3 minutes. Okay. So why don't we jump over to Grant and we'll do the UCSC presentation first, and then we'll jump back to Josh. So Grant, hopefully you're ready and prepared to share out.
Great. Hi, everybody. I'm Grant Hartzog. I'm a professor of molecular cell and developmental biology here at UC Santa Cruz. And I'm also the executive director of our new global and community health program here at UCSC. So if you can go to the next slide. So this program is the product of 3 or 4 years worth of work now by a group of more than 60 faculty spanning the entirety of the university. And if you go to the next slide, the goal of this program is to provide an interdisciplinary education for students who are interested in healthcare careers. And it's really driven by the recognition that healthcare is nearly 20% of the United States economy. And as COVID has shown us, we live in a world of great inequalities in healthcare, both locally and globally. And our hope is that we're going to train large numbers of students who are ready to go out and contribute in many different ways to that world. And an additional goal is to create a real nexus of research involving health within the university to raise our profile for health research. We often hear you don't have a medical school, you can't do health research. Well, we've been doing it for years. And we want to be a greater asset to the many organizations that are involved in healthcare delivery within the local communities. Next slide. So the program has got two major arms that launched last Thursday. So we're offering a Bachelor of Arts degree and a Bachelor of Sciences degree. And the BA degree is really mainly aimed at students who want to go into a wide variety of healthcare careers that don't require a professional degree. So everything from masters in public health to healthcare administration, to community-based healthcare work, to healthcare policy. And throughout both this BA program and the BS program, we've got a heavy emphasis on the social determinants of health. The BS program is primarily aimed at students who are thinking about professional degree programs in health. And by that, I don't mean just medical school, but the whole gamut of professional degree programs. So PA, nursing, pharmacy, dentistry, as well as medicine. And again, we want students to have a deep understanding of the intersections of the science of medicine with the social sciences, economics, psychology, and so on. And so a founding principle of all of this is that these are really deeply interdisciplinary program. We bring together an interdisciplinary group of faculty, and we've shaped the programs to encourage students to work in interdisciplinary groups as well. Next slide. So in the BA program, students are given opportunities to learn about the social, cultural, political, and economic determinants of health. We talk about healthcare policy, where it works and where it doesn't work broadly. We encourage students to think about their own experiences. Students in this program are much more diverse than the students in the university as a whole. They often come from poor communities in the South County. These are kids who are authentically driven to go back and serve their communities. So we encourage them to see their prior experiences and family experiences as a strength that they can bring forward and apply as they think about careers in healthcare. We talk about the history of global health and community health. We talk about the ways in which health is represented accurately and inaccurately in the world. And we imagine, as I said, that this could be a program for students who are going into careers that don't require a professional degree, but it could also be paired with a STEM degree for students who are going into professional programs but want a broader education. Next slide. The BS program, some of you are probably aware of our human biology major. So the BS program is modeled on that and will replace that. It satisfies most of the prereqs for health professional programs. It includes an internship requirement, and many of you have been very kind over the years in helping our students get those internships. And it includes many overlapping courses with the Bachelor of Arts programs. And in fact, we require the BA and BS students to come together periodically through their educations and work in interdisciplinary groups. And then the next slide. So we've got two concentrations in the BS. The first is nearly a one-to-one replication of the human bio program, just a name change. With the addition of an epidemiology course and several courses on the social determinants of health. So this is really for students who want a rigorous preparation for professional schools, graduate programs in the science of medicine. But we require that students take 5 quarters of Spanish, including medical Spanish, because we know if they're training in California, they're going to have to speak Spanish with many of their patients. And then we have the public and community health concentration, which satisfies the sort of the bare minimum of health professional program prerequisites, but then in the upper division provides a much broader education in the social sciences and the social determinants of health. And we're imagining that this would be perfect for students who want to combine a professional degree with an MPH. Next slide. I'm also working with the University Extension to stand up a post-baccalaureate program. I assume most of you are aware of these programs, but these are programs for students who want to go to professional programs but need some additional coursework, need to raise their GPA, need help with test prep or preparing their applications, need mentorship, and so on. This program is really aimed at increasing the number of medical providers, healthcare providers in our community. So we're going to target students who grew up in the county, the South County or South San Jose. We want to raise scholarship funds to support about 15 to 20 students a year. And although we're initially aiming to launch this program next year, for pre-med students, we hope to broaden it out to include students interested in nursing, advanced nursing degrees, pharmacy, PA programs, nurse practitioner, and so on. And then the next slide. So all of this depends on us partnering with you. The real goal here is to collaborate with you on local healthcare workforce development. And we really are aiming at identifying students who are going to go back to their home communities, who look like the people they'll serve, who understand the cultural contexts of those communities. We're assembling right now a community advisory board. Maritza Lara joined us just yesterday, so thanks to Maritza if she's here. And we really want to partner with local organizations. We can provide you with student interns, students who are interested in volunteer work. And as I said before, we're hoping to foster faculty research that helps you identify, understand, and meet healthcare challenges that your organizations may be facing. I'm also aware that the state is trying to increase the number of community health workers. And I'm very interested in learning about that and seeing if we can't collaborate with any of your organizations to help train those people as well. So thank you. I've got one more slide, but that's just to say, does anybody have any questions?
This is fantastic, Grant. I'm so excited. My name's Allie Hayes, and I work for the Health Improvement Partnership. But for the past 9 years, I worked up at UCSC under the umbrella of health promotion at the Student Health Center.
Oh.
We had about 60 students a quarter that were volunteering, that were hungry to do, health equity, public health work. And I'm just so excited our university has these degrees. It's just fantastic. And I taught Intro to Public Health for the Community Studies program last spring.
Oh.
And I was just struck by the incredible students in my class that, just like you said, were really wanting to go back to their communities with the tools to improve health outcomes and improve access, and really think about the lens of public health and working in their communities, also managing inherently racist structural systems and how to do good health work within that. So I just wanted to say you're awesome and I'm excited.
Thank you so much. And I should say, because we're basing the Bachelor of Science on the human biology program, we instantly had 500 students in the program. We're graduating on the order of 80 to 100 students a year, and we expect it to grow by at least 50% over the next few years. So it'll be substantial numbers of students.
Thank you so much, Grant. I'm also thrilled to share that this Grant and some of the other faculty and staff at UCSC are going to be actively engaged in our Health Workforce Council and participating in our work groups. So this isn't the last that you're going to see from them or hear from them. And we're thrilled to have you present today. If there are questions, we have maybe about a minute if anyone wants to vocalize a question, but you could also put your questions in the chat. And Grant, if you're comfortable sharing your email in the chat, people could also reach out and follow up with you that way as well. Any questions for Grant? If not, again, he just dropped his email in the chat, and you can also put questions in the chat. So with that, Josh has joined us. I feel like I'm like, Elvis is in the building. So we're gonna skip back up to the beginning of our slide deck here, and I'm gonna hand it over to Josh, who I did a little brief intro to you, Josh, a little bit earlier, but if anyone joining late, Josh Williams is the president of the BW Research Partnership, and he presented at our HIP Annual Community Forum. It was such amazing content that we wanted to invite him back with additional time to do a deep dive and share out the state of the workforce, especially healthcare challenges and changes for this year, 2022. So I'll hand it over to you, Josh. Thank you.
Great. Thank you, Haley. And sorry for being a little delinquent in my jumping on. Yeah, so this is part of the state of the workforce that the Santa Cruz County Workforce Development Board does every year, and one of our areas of focus. I mean, we look at kind of all of the workforce issues, but this year we did a deeper dive in healthcare, and healthcare is an important part of Santa Cruz County's workforce in general. So it's something we look at kind of every year in the state of the workforce. So with that, I'll try to talk a little slower than I did at the forum a few weeks ago. And if there's any questions, feel free to ask. So let's jump into the first slide. Yeah. Okay. So I think one of the things that we just need to be aware of as we look at this, and I know a lot of you that are employers in the healthcare world already know this. The labor market has really changed in the last 3 or 4 years, and has gone from a kind of a relatively loose labor market to a really tight one. And that's driven by a few different things, a few different factors. But Santa Cruz County is really feeling it, right? So you can see that the numbers, and we looked at some more recent trends, and it's going up a little bit. But the challenge is the actual size of your population is declining a little bit. So the tightness in the labor market really isn't changing, and we don't expect it to change anytime in the near future. So what does that mean for healthcare providers? It means you're going to have to be a little more creative, and you're going to have to be probably you're going to have to spend more time recruiting and finding and developing the talent you need, and things like employee retention is only going to become more important, right? And figuring out ways to kind of upskill and train your current workforce so they can take on their responsibilities. All of these issues are going to become more challenging, going to require more commitment, and to be honest, are going to be just more expensive, at least for the foreseeable future. And when I say that, I don't see the kind of the fundamental kind of labor force tightness changing in the next really 12 to 24 months. Anything beyond 24 months, who knows? But I would say this is the kind of your current reality, and I think it probably makes sense to kind of think about these things, and at least planning for the next 3 to 4 years in this new kind of world of work environment. So this is a challenge across the country, but it's particularly relevant in a coastal community with really high cost of living, where more and more people are leaving because they can go work remotely and find new options. So I think that's kind of an important big picture perspective. And this data really shows, while it's a California challenge, it's a national challenge, it is definitely a Santa Cruz County challenge, even more so. So with that, we can jump to the next slide. I think again, big picture, and we'll dive into the specifics of healthcare in just a second, but I think, why is this happening? I mean, it's really happening for 3 or 4 reasons. The pandemic highlighted it, it was kind of a short-term, changer, but the underlying drivers of this tight labor market are really not about the pandemic. The underlying drivers are really about the demographic composition of the community. It's about educational attainment, and one of the realities are, less educated residents are less likely to work. It's about immigration and net migration, and both of those internationally and within California, within the country. And there's also, it's about barriers to work. And we'll talk about childcare, and we'll talk about transportation, we'll talk about housing, but all of those things are definitely impacting, the size of the labor market, which is impacting your ability to recruit and develop new workers. The pandemic definitely accelerated the decline, but you're almost seeing, you know, a revision or reversion to the norm, to the kind of the mean, I should say. You know, from December 2021, there's been 6,400 fewer workers, and net migration has declined as well. So all of those are contributing to the challenges in terms of kind of the tight labor market in the county. Next slide. There are some basic changes. I mean, one of the questions we get asked is the pandemic, you know, there are things that are reverting back to kind of where they were, but there are things that are also fundamentally changed. And, you know, the same number of people are not going back to the office, or at least not going back in the same, you know, they're not working 5 days a week in the office. And there are more opportunities and changes for where people work. And that's becoming the challenge for healthcare, is that's becoming a requirement for a lot of workers. One of the things that we're seeing in the Central Coast and really in California, more and more younger workers particularly are saying they don't want a job they don't see a good future in. And I think that's both a challenge and an opportunity for healthcare. Because I think the opportunities for good jobs are definitely there. And it's not, you know, I mean, the reality is in other industries, there's not as many kind of clear and distinguished pathways like healthcare has. I think the challenge is that needs to be communicated, and that needs to be aware to kind of different, you know, individuals and different backgrounds and different kind of starting places along these different pathways. People are not spending as much time in shopping and at retail establishments. And there are, you know, there is a need and a greater demand for kind of workforce housing in the county, and people are starting to travel again, and so you're seeing that in terms of you know, an impact, particularly in tourism and hospitality. Let's jump to the next slide. So let's spend. I mean, those are some of the kind of the big picture findings. Let's talk a little bit more about some of the changes in healthcare. I mean, one of the biggest challenges that so first of all, healthcare makes up about 1 in every 7 jobs in Santa Cruz County, and it has, you know, a larger multiplier effect. So kind of this is an important industry for lots of different reasons. I mean, we shouldn't minimize the importance of, we all want healthcare. It's important for us to live. So yes, I mean, I think I'm preaching to the choir on that. But this is the industry that grew a lot, you know, from 2010 to 2020. And it's being challenged now in terms of growth patterns, but I don't think it's because of the demand. You know, I mean, we can talk to the employers, but it's not because the employers don't want new people. They're just having a hard time finding and keeping them. Nationally, almost 1 in 5 healthcare workers has quit in the last 18 to 24 months. And, you know, in the pandemic, about 10 to 12% were laid off in certain positions. There's been a lot of churn and change within healthcare. And because of certifications, non-healthcare, it's harder to transition from one industry to another. And that's something that I know the industry is looking at and trying to find new solutions for. And there are some examples of that, but it is a challenge. In the state of the workforce, there's a lot. We did a fair bit in the back, in the appendix, looking at which are the jobs that were most likely to be able to transition into healthcare positions. And we did kind of a full analysis, kind of an occupational analysis on that. And the reality is most of the jobs that are best to transition from healthcare jobs are also in healthcare. So, you know, having that background in the industry is really important. And it gives you more ability to kind of move around within the industry, which is both a strength and you know, it's both a challenge and an opportunity because you really need to, you know, find new people to get in, and that's a little harder because a lot of the transfer opportunities are best for people that already have some experience in the industry. Next slide. So we looked at kind of what have been the reason that people have left, you know, workers have left their healthcare jobs. And to be honest, you know, the pandemic really created a lot of stress for people. And you know, I think that was a big challenge, but you did see a real need for more money and better benefits. And you can kind of see, you know, burned out or overworked. And a lot of that is, you know, tied to the pandemic as well. So the pandemic really created a kind of a dislocation and a churn, which is problematic because healthcare workers typically take longer to kind of develop because of the educational requirements, because of the, you know, the increase in kind of technology, the upskilling that's required in the increasingly technical roles within the industry. So, you know, I'm not going to go through each one of these, but you can see that there's a lot of challenges within healthcare because a lot of the workers are feeling burned out, and the pandemic really added to a strained and stressed situation that just got worse. And so I think one of the things healthcare, and this is true in Santa Cruz, and it's true really across the country. In some ways, it's more challenging in Santa Cruz because of the housing and some of the cost of living requirements. But there is a real need to kind of talk about the opportunities and the long-term ability to upskill and move along different career pathways with both, increasing responsibilities, but really increasing, pay and kind of benefits as well. Okay, let's jump to the next slide. I think this is something, I'd like to kind of talk about. Let's, the state of the workforce kind of identified some workforce development opportunities that were specific to, to the entire county, but also, were really relevant. I mean, given that 1 in every 7 jobs in the county is healthcare, and given that there is a multiplier effect, meaning as we've solved some of the more general workforce problems, we're also going to be helping out the opportunities within the healthcare arena. There is, still a sizable portion of unemployed, underemployed, and disengaged workers. And I think one of the problems that we too often focus on is, unemployment rate tends to be the kind of the end all and be all in terms of our, labor market awareness. But the reality, there's a portion of workers, if you're not looking for work, you're not unemployed. If you're working in, a bare minimum job, just getting by, you're not unemployed, you're underemployed. And, one of the challenges that we need to find both as an industry and as a county is how do we, increase, the opportunity. So you're looking at 3 challenges. And so we've talked about kind of labor force participation rates, but I think the other challenge that you're facing is that net migration and people that are moving out, particularly younger, 24 to 54. And that's really why is that age cohort so important? Because that's the age cohort that's your primary workforce. Those are the people that, 85% of them are working, right? So you have 3 challenges the county faces. One is obviously you want to get people working, meaning wanting to work, that labor force participation rate. That's what we started with this. But also making sure that you're attracting enough of that working age cohort to live in the county. I mean, one of the challenges healthcare has is there's some remote work in healthcare, but on the whole, these are jobs you're drawing from a workforce that needs to live within the county. But then I think the other part of it and the real challenge, from a workforce development, but also from a kind of an industry perspective, is labor fluidity. And what that really talks about is the ability of people to part of it is the people to move for jobs, but really what we're talking about is the ability for people to learn new skills and move up in their skills and abilities to go on and take on new responsibilities. How do we take someone who's currently working, in a low skill, low paying job, let's say, in the retail industry and get on a pathway that allows them to grow in the healthcare industry. So labor fluidity, labor force participation rate, and then really focusing on, that age cohort of 24 to 54, because that's where your workforce comes from. And to be honest, the younger ones are nice because they can, you've got 10, 15, 20 years. So how do we support all those, those goals? And I think one of them too, particularly with that really younger part, that 24 to 40 age cohort, childcare, transportation, housing are particularly a problem. And I think one of the other issues that we talk about in the report too is particularly a lot of your lower income households in Santa Cruz County. A lot of them don't have access to the internet, and that's a real challenge. Because a lot of them can't find out where a lot of healthcare jobs are, right? So we need to make sure that we have enough bandwidth in these households so that they can really be connected to the economic and the employment opportunities in healthcare. But also looking at ways of supporting childcare and transportation housing within the county. Those are all kind of significant obstacles for re-engaging. There's also looking at ways of kind of facilitating, there's some valuable community-based organizations, like your own, and how do we connect with other organizations and comparable, organizations that are doing like work within the county and outreaching to the kind of the key populations, disadvantaged and underserved populations that exist in Santa Cruz. I know some of you, I know that's already what you do, but I'm sure there's the ability to kind of just speak to more. I think also too, the more that we can do to really attract and communicate to students and potential workers, the kind of pathways and opportunities for kind of wages and upward mobility, but also, any kind of apprenticeship, learn and earn, whatever those, challenges are. When you have an unemployment rate and a tight labor market, telling people they need to, stop working and go back to school for, 6 months or a year, or however long it takes, probably isn't very realistic right now. So we need to be creative in how we allow people to work and develop foundational skills to get into healthcare. And what does that look like, and how to move forward on that? Let's jump to the next slide. Yeah, I think that, I think two challenges that you need to be aware of in general, and really looking at kind of the national healthcare workforce is, even without kind of the pandemic and the tight labor market and all like this, healthcare is a mature industry that is going through some pretty significant changes in terms of the kind of the technological and technical requirements, whether, related to data, related to new remote monitoring systems, to kind of all these new technologies. So even if we didn't have the pandemic and the tight labor market and all these other challenges, just keeping workers kind of up to date and kind of keeping them able to kind of handle all the new kind of technology and technical requirements of the industry is something that we need to be thinking about. We don't want to get too far behind on. But then also thinking about, how are and this is something that we're seeing, the occupational profile of what are the jobs, particularly at some of the clinics, but even at some of the hospitals, they're changing. Right. And so just taking your occupational profile from 2020 and expanding it out to 2030 isn't really good, because what's in demand in the workforce in the healthcare workforce is changing. So both the skills and the technical requirements are changing, but also the occupational profile between hospitals and clinics and and even some of the long-term care providers and residential care providers. So yeah, that's hopefully on that a little bit. I think at the end of the day, we can't talk about kind of workforce and, workforce opportunities and challenges without talking about housing and housing near kind of work and transit hubs. I know it's not one that you have a lot of control over, but in any way that you can advocate or work with partners to really try to look to expand and improve workforce housing and affordable housing options in Santa Cruz, it's just, I wouldn't be an honest researcher if I didn't say that's just a huge obstacle right now. And it's one that's particularly challenging in, the Central Coast, right? Where your housing costs are, really high. And one of the biggest metrics that we use, I think that you should think about too, is, the problem is we have a poverty rate that's built around the cost of food. And food's not what people spend most of their money on today. People spend most of their money on housing. So what percentage of your workforce is spending, over 35, 40, 40% of their gross income on housing? That's a real measure of kind of economic distress, right? Not how expensive the food costs are, right? That may have been valuable 100 years ago. It was valuable 100 years ago, not valuable today. So building metrics around the poverty rate, I wish the federal government would get up to speed on this. And I think everybody in this college needs to understand the percentage of your income that spends on housing. That's the real measure of economic distress. Because if you're spending over 40%, 35% of your gross income on housing, that just, it makes everything else that much more challenging. And I think you'll see that if you look at, a lot of your entry-level positions. That's just a reality in Santa Cruz. So how do we fix that? One of the ways is, expanding the workforce housing supply, but also looking at, new creative ways of providing kind of, lower cost housing for those individuals that are working in entry-level positions within healthcare, I think would be really important. I think I have one more slide, and hopefully I've talked a little slower, but probably not that much, but here we go. Again, I think a lot of this is kind of threefold. I think we need to figure out, let me finish the last point and I'll talk kind of big picture. I think particularly in South Santa Cruz County, there's a larger portion of younger adults that are relatively low educational attainment. And that has a trickle-down effect, both in terms of their labor fluidity, meaning their ability to kind of go into new jobs, but it also has an impact on their likeliness to work and their likelihood of staying in the region, particularly as the area gets, as the housing issue continues. There's a large portion that a lot of these younger adults in South Santa Cruz County may leave, and that's a lost opportunity in terms of increasing your workforce. I mean, when you look at a lot of the demographic data, there is definitely a geographic divide, and a lot of it is ethnic as well. I mean, this is largely younger, this is 24 to 39, male, Hispanic, low, low income. How do we fix that? How do we help that group increase their educational attainment, which will likely increase their labor fluidity and their likelihood of being able to live and thrive in the county. So lots of information. I will say there is a lot more detailed occupational information in the state of the workforce. So I would recommend particularly looking at a lot of kind of specific occupations. I think one of the challenges that we have and that we need to continue to look at is how the technical requirements for healthcare workforce is changing and how the occupational profile of healthcare is changing. Healthcare is an interesting industry for us because, like I said, it's this very mature industry that's going through a lot of change and churn. From a kind of a workforce, from skills, from a development perspective. So, yeah, I think I'm about 20 minutes or close to it. So
you still have 5 minutes, Josh. You still have 5 minutes if you want to elaborate or add anything else.
I'm sorry, can you say that again?
You still have 5 minutes if you want to elaborate or add anything else.
All right, wow, I'm not used to having 5
or you can
minutes.
open for questions.
So yeah, I mean, I guess all I would say, and so these are let me talk a little bit about kind of the 3 questions that we continue to kind of think about for the healthcare workforce. So, I think we've already seen, and there's good models of the relationship that is growing between kind of life sciences, and it's always been there, right? Life sciences has really looked to serve the healthcare community. But one of the things that I think we haven't done as much work on is looking at the potential collaborations between kind of the life science workforce and the healthcare workforce, and particularly looking at some of those opportunities may have in terms of you can start people in healthcare and maybe they transition over to life sciences and really vice versa, and looking at some of those opportunities. We are, like I said, as we talked about before, we are looking at how healthcare occupations are changing just in terms, not only in terms of titles, but also in terms of the skills and the technological requirements. So I think that's an area that we want to really look at and kind of dive into. And then lastly, I would say, this is again, Santa Cruz, Monterey, San Luis Obispo, Santa Barbara, they're all kind of facing this challenge, particularly that's nationally but you're ahead of it, meaning the challenge is even more acute in those kind of 4 or 5 counties because A, they're expensive, B, the cost of housing is, they're also seeing though that net migration is a problem because a lot of their younger workforce is leaving and going to, to different places where they can afford. So it's going to create a real challenge. How does, these 3 counties in this large kind of mega region, at least in terms of size, maybe not in terms of total population, how do they look to overcome this workforce challenge, which is probably most acute in healthcare because of the very clear and I don't want to say inflexible, but there's educational requirements that you just can't kind of skip around, right? I know a lot in, even in like, finance and insurance and real estate, a lot of those industries, they're just lowering their educational requirements, right? Which you can do if you're in finance. You can't do if you're, a registered nurse, right? Or anyway, so those are kind of the challenges that we're looking at, and we're kind of looking at some of the best practices, and there are some interesting models. But again, a lot of these models they are looking at things like housing, which I know is not, traditionally in what you would focus on, but in areas like Santa Cruz and, Monterey and, Santa Barbara, you kind of have to, because that's the biggest obstacle to getting new workers. I see a hand. I think that's Allie. Yeah, I'm happy to answer any questions.
Hi, Josh. I'm really enjoying your talk. Thank you. The question I had was, in all of your deep diving and research, are there any models that you're aware of where there is a link to affordable housing for healthcare workers? Are there any models where you're seeing like there's pay, there's job training, and there's actually housing? Yeah. Because if we could see it, right, then we might be able to imagine it and build it and even envision what that might cost. And
so
then
I haven't seen any that are healthcare specific. It's a great question, Ali, and it's what I think is really important. I haven't seen it healthcare specifically, but I have seen kind of regional collaborations, and that's one of the reasons why. Meaning, if healthcare and life science and some of these other industries could come together and say, we're going to work with the county to identify some opportunities to develop some workforce housing. So I know that Pittsburgh had a program that they were developing kind of in this kind of multi-industry collaborative approach to develop some workforce housing. The irony is the cost of housing in Pittsburgh is considerably less as a percentage of their income, but they have the ability to. I think one of the challenges is, and I think San Diego is talking about something like that. So they haven't implemented it, but they're looking at it. Yeah, I mean, I think it's one of those areas where we probably need to do some more. We need to not do some research. We need to find some examples and see how they funded it, because I think that's the real challenge.
Yeah, that was the follow-up part of my question is funding. Where do we look for funding? What kind of funding pays for housing that's intrinsically linked to what we're trying to do, which is build up our own workforce and then improve the health outcomes of our region. So that's the part I'm thinking a lot about, like, what kind of funding do we even look for? So
right.
Those are my thoughts. Thanks, everybody.
Yeah, no, Ali, it's a great question. I wish I had a better answer than I'll ask around. I mean, again, I think these are things that are being talked about. And again, there's been some models. I haven't seen anything on the West Coast. I have seen some examples on the East Coast. The irony is the areas where I've seen some examples, the housing is generally less expensive. So it's a little easier to do. In the hardest areas where housing is most expensive, I haven't seen a good best practice or a good example. But I think it's a question that we're asking, and I think the funding element is central to that. So I don't know is the honest answer, but we're going to keep looking, and we hopefully have a better answer for you in the next 6 months, a year, because I think it's really important.
Maybe that will be in your next report for
I hope
2023, how to get affordable housing in
sure.
Santa Cruz County. Laura, I see you have a question.
Yeah, actually, I thank you for this. This is so interesting and so spot on in terms of our experience. I was going to mention, in terms of workforce housing, we had a recent experience. Dianthus Community Dental Care, along with Santa Cruz Community Health, is developing a campus, a health and housing campus with Mid-Penn housing, and the 57 units of affordable housing that are being built behind our new clinics were, we thought, a potential opportunity to do just that, is fund some workforce housing. And unfortunately, back to your question, Ali, the funding sources for the apartments that are getting built are absolutely not aligned with the need for workforce. Of course, they're supporting workforce in the sense that the people, the families that will live there will be part of the workforce, but not necessarily part of our workforce, because the federal funds, the HUD funding mostly that's coming, the lending that's coming through, has to be specifically for lottery style chosen selected families based on eligibility, income eligibility, and not related to necessarily their current geography or current workplace. And I really question, I really actually think that only changing legislation, changing laws, and actually pushing at the federal level for those funds to be used and dispersed in a little bit of a different way, will that ever change? You guys might have heard that Live Oak School District is currently working on a measure locally here to fund workforce housing for teachers. But if it's going to be going after local tax dollars, it's going to be a lot harder to bring in the amounts of money needed for workforce. I believe the Mid-Penn housing on our property is about $1 million per build. So per apartment, basically. So imagine the kind of funds that would need to come in order to locally, produce that type of housing. So I think going after federal legislation, state legislation that can support this is really the only way we're going to see enough money come through.
Yeah, I mean, I think, Laura, you're wiser and smarter on all the stuff than I am, because you're living. I really appreciate that. I think we do have a problem fundamentally in that they like to do, that lottery approach is something they feel is somehow more I've seen it in other places too, and it's very hard to build programs or have a strategy when you do that. And that's, to be honest, you're starting to get into some of the bigger kind of just general strategies with immigration like that are problematic. We should connect these things to skills. We should have a more systemic approach to kind of how we support housing and immigration and all of that, and we haven't. And again, at the end of the day, we kind of, as a researcher, I just have to say, what are the things we can control versus what are the things we can't? But you're right. I think it is through state and federal legislation. And I think the problem is that then requires some sort of kind of legislative approach, which I'm not sure, any of us really have the time or inclination or the ability to be able to do effectively.
Sounds like we'll put together a work group for affordable health workforce funding. Well, thank you so much, Josh. I'm really glad you were able to come back and reshare this information with us, especially doing a little more in depth on these recommendations that you have put together, which is so super helpful. I love that you have early, middle, and high school exposure to a range of healthcare careers as one of your recommendations, because that's a great segue into our next presenter. Yeah, thanks, Josh. Yvette Brooks with Your Futures Our Business is going to present on their programming that does exactly that. So Yvette, I'll hand it over to you.
Hi, everyone. Nice to see some familiar faces. And for those who've heard this a million times, feel free, Laura and Andy, to go get a snack or some lunch, because you two are such incredible supporters of our organization. So for the rest of you, and I see the other Laura, Marcus, nice to see you. So I'm Yvette Brooks. I am the Executive Director for Your Future is Our Business, and I'm here just to share a little bit about what we do in the community. Next slide, please. So we've been around since 1993, when a group of administrators over at the County Office of Education said, we really need to provide students a robust opportunities for career exploration. And it was somewhat of a requirement by the state back then. And so they essentially created Your Future is Our Business to provide what we call work-based learning experiences. Next slide. So those work-based experiences is twofold. It provides this career awareness aspect and a component of career exploration. So career awareness are experiences that help students build their awareness of a variety of careers available and of the post-secondary education expected for these careers. Career awareness experience also broadens students' options by helping them become aware of opportunities available across a wide range of industry sectors. And in California, we have 15 identified industry sectors, and health is one of them. So the career exploration component is the opportunity to explore the career options in a way that contributes to motivation for learning and inform students' decisions about further experience. So we're not going in and saying, oh, this is the only pathway for you. We essentially allow students to explore as many opportunities as possible. And so, next slide, please. So what we do in order to provide these experiences is we collaborate with the educators and students. Our funding comes from the school districts primarily. We do a little bit of grant writing, we do a little bit of partnerships and things like that, but mostly it comes from the school districts. So several years ago, the state said, no more just giving funding for career for CTE courses just to the County Office of Education. We're going to give funding to all of the school districts separately. So that's what we call LCFF, right? The local control funding formula. So now the districts have the funding and they're responsible for providing their own CTE classes, their own pathways in the high school, at the high school level. So now we contract with a whole bunch of different folks instead of just the county office. And so how do we do that? How have we been successful for the last 30 years? And that's because we collaborate with our industry. So all of our volunteers are from organizations from the community. We primarily, our mission is to serve every student in Santa Cruz County. And so we partner with the county, with private sector, public sector, everybody that you probably know somebody who's volunteered at some point to provide a work-based learning experience for our students. And so that's essentially what we do. Next slide. So those work-based learning services or experiences include, so this is our menu of services. This is what the districts get to look at and choose from. Our career days, expos, speakers, internships. So currently we have four interns supporting our organization. We provide workplace tours. We also do these really fun informational interviews where the student actually gets interviewed by the professional. And so they not only are gaining those transferable skills, right, with just learning how to interview, but they're also being asked by the professional or the expert the real kind of questions they would anticipate in a real job interview. Next slide. So this is just what we looked like when we were in person. I should add that I've only been in my position for a year now. And so when I came on board, I said, this is not what it looks like. We're doing everything virtually, but we are back in person. And we have successfully brought on not just all the comprehensive high schools in the county, but we've also brought in elementary and middle schools. And so we are now serving elementary through college because our interns come from college, from the Ganas program, which is a phenomenal program for first gen Latino students. And so those who are interns are, but so we're serving a whole broad range. And you'll see here these expos and what career speakers look like in action. Next slide. So I mentioned our interns, and last year, the very bottom four are the ones I was able to work with. And I'm actually tonight having our 3 new ones come over and on board. And so they are essentially the nuts and bolts of what keeps this organization together. We are teeny tiny. When funding comes from school districts, you all know that funding is very limited. And so it's just me as the executive director, my phenomenal board. Of course, Haley is on our board as well. And then the worker bees are our interns. So when we get a request in from one of our contracted school districts to say, hey, I'd love to put together a career speaker series, like I want 2 every month in the medical field, our intern would then contact all of you to sign up and they would organize that essentially. Not only do they do that work, but then they do the social media shout outs. They make sure that you guys are getting on the What to Be radio podcast. They're making sure you're staying connected and linked to the students and our organization for eternity. So once you volunteer, Andy knows you're locked in, you're never leaving us, you're forever a volunteer. And that's thanks to our hard work here with our interns. So there they are in action. Just a great story. Our previous ED was Melina Long, and she was an intern for us prior to that. And so we really believe in the succession of our students. Another great example, one of the interns that I was able to work with was really interested in becoming a dentist. And so while he was an intern, I set him up to job shadow at one of our pediatric dentist offices here. And so simultaneously, he was able to get to gain these skills, and he's still there volunteering. I was like, what happened? You left us and you're over there. But it just goes to show the impact that we have across the board in making these connections, because it really, really is the support of all of you that creates the success of our students here. So our goals is to expose you to new career and spark student interest. How many times do you hear, oh, I just want to become a doctor? And then all of you experts here say, what kind of doctor? What do what kind of school do you want to go to? What are you interested in now? Have you ever worked, just like there's just so much there. And so when we get that request from a teacher that says, oh, I just want a career speaker in health, oh my gosh, it's like the world's our oyster, right? We could literally bring anyone in. And that's the best part, because then the student gets all of this, this interest in all different types of career fields in that industry sector. So it's essentially to inspire the students by sharing your successful stories and your pathways, right? Like none of us only had one job in our lifetimes, right? We've had, well, I'll admit it, like 20 jobs. And so it's really important to inspire them, to connect them, to shift that culture. We're in, someone said it, the great resignation. And so we want to offer that and retain the skill talent in Santa Cruz County. So we want them to stay here. Next slide. So this is actually old data. I know it says 2022 in May. And so our impact, though, is just as influential. Our students really gain a lot at the high school level. And I hope that next year I'll be able to show you the elementary and middle school impact report as well. We have an annual review on our website, YFIOB.org, that you can take a look at all the agencies we've worked with. Next slide. So it says, I would be very disappointed if they didn't hold a career event like the one we had today. On November 15th is a perfect example. We're going to be holding our first ever Trades Day, where all students in the county who attend a CTE class in trades, they're going to get to meet all sorts of different agencies. And I hope we create one similarly with in the medical field here. Next one. And then, just really driving it in, it's also so meaningful for our career speakers. I have these conversations with folks who are like, my story doesn't matter. I just kind of did this and this, and here I am today. And, I think that essentially all of your story matters, right? How you got there, what type of school, if you went to school, the challenges you face, what's your day-to-day routine like? Do you have families? How do you balance all that? All of that matters. And it's really important to share your story. Next slide. So this is as approximate number served since 1994. And I can promise you that just last year, we've served over 2,000 students. So our number in terms of serving students has greatly grown and will continue to grow. Next slide. Our adorable, adorable pictures and students here. Next slide. And so how do you get involved? What should we do? I ask all of you to go on to YFIOB.org and sign up to become a career speaker, to become a panelist, to offer a job shadow or a mentorship, an internship. We just partnered with SoCal Creek Water, who said we have some funding. We want to hire an intern, but we don't know how to do it. So they pay us. We pay the intern, and boom, they have a great intern to work with them to get that experience. So we are essentially this silo in filling the needs for your agency while offering students really insightful opportunities to help them in their career exploration. So thank you so much. I know I blew through that, and follow us on Facebook, Instagram, LinkedIn. We're on there. We need more followers. We post every single day. It's a job of my intern. So please, please, please look us up on all 3 platforms and start following us today.
Thanks, Yvette. Maybe you can put the link in the chat for the sign up to be a volunteer. So if people are interested. And I'm thinking now we should host a healthcare career event for all the students in the county. So we'll talk more about that.
Yeah.
Okay, so you can go to the next slide. We're going to just do a very quick report out on just the quarterly milestones for our Health Workforce Council. For many of you, you were here when we launched in June. We did our first official Health Workforce Council meeting, and that meeting in June was the launch of all of the work groups that we are working on getting established. Many of you were able to attend September 14th, our annual community forum, which was just a couple weeks ago. The theme was health workforce, and it was a really exceptional event. And we will be adding the video recording and the presentation slides to our website. So we'll be sure to send that out to this council so you guys can review that if you weren't able to attend. And then today we're at our second quarterly Health Workforce Council meeting. And we have currently 4 work groups established, and we've completed our charter for the Health Workforce Council. I'll share briefly. So the behavioral health work group championed by Holly Hughes, who was on this call, but she had to leave a little early. Right now, we're currently focusing on pipeline development for associate level supervision for people in their postmasters pre-licensure status. And the community health worker work group, we're working on creating a resource guide and a community flyer that will help promote community health worker career pathways to the community and provide information on how to get started and where to get training from. The nurse work group is recently launched, so we're focusing on recruiting and retention in the workforce. And I don't know, Ashlyn, she was on this call, but she might have had to drop off early. So the medical assistant work group, we're actually co-hosting with Cabrillo College their Career Technical Education Advisory Committee meeting on October 12th. It will be online, 10 to 11 a.m. on Zoom. And if you are interested in participating in Cabrillo College's Medical Assistant Advisory Committee meeting, we encourage you to join us. They meet twice, once in the fall and once in spring, so it's not a huge commitment, but it's really important for Cabrillo College to get employer feedback. It helps guide their curriculum and program development for the medical assistant program. So with that, you can go to the next slide. We want to move into just an open discussion for folks in this group to share with us what current infrastructure is supporting workplace learning in your clinics and hospitals. You just got to hear a little bit about Your Future's Our Business and Josh's recommendations, UCSC's program that needs placements for interns, and kind of some of the projects that our Health Workforce Council work groups are working on. And so now we want to hear from you. So feel free to unmute yourself if you can introduce yourself quickly with, name, title, and organization. We would love to hear from you at this time. Or it could be developments you're currently working on that have not yet come to, be implemented yet. Anybody want to share?
I'll share out. So I'm Todd Livingstone. I'm the assistant director for Watsonville Santa Cruz Adult Education. And our current project we're working on is an LVN program for our students. We currently offer CNA, clinical CMA, medical assisting, PCA, personal care assistant, EKG, dental assisting, pharmacy tech, and some other medical classes such as a medical terminology class. But our work right now is we're in the process, the approval process for our LVN, and we're hoping, we've already gone through a couple hoops, but they're getting smaller and harder to jump through, but we're getting there. Thanks.
What does that, what's the time frame for that, Todd?
I think our next is going to be January, like mid-January is our next big review, and we were on the waiting list for like 3 years. Mm-hmm. And wow. So we're in the process.
Do you want to speak briefly about the home health aid certificate program you guys are launching as well?
Yeah, the personal care assistant.
I thought there was one with Hospice of Santa Cruz
Oh,
teaching a home health aid course that's going to
yes.
be launching in the new year.
Yeah, we are. They were super helpful in getting a teacher for us. So we have the teacher is going through the process right now, and we hope to be offering that in the winter.
Anybody else have work-based learning, internships, apprenticeships, externships, placements that they're doing? I can speak briefly for what HIP does. So we have AmeriCorps Vista students that work with us for a year. And then we also work with Health Career Connections, which is a internship program. It's actually nationwide, and they serve underrepresented students and help place them into internships and provide programmatic support and professional development support for interns while they're in their internship. And it's typically a 3-month summer, like a 10-week summer internship program. And then we're also hosting UCSC students from actually the MCD Bio program. So we have a student right now currently working with us for 8 hours a week for 10 weeks. And then I think, Paola, do you want to share a little more about interns that you've worked with?
Hi, yes, this is Pamela Price. I'm the Director of Education at Watsonville. We actually have a residency program with Cabrillo College, where the RNs are doing an internship here after they have graduated and passed their boards. They spend 10 weeks in intensive classroom training with Cabrillo, and then with us full-time working on the floor, with the understanding that, you know, we'll hire them afterwards as long as their performance is satisfactory. So we had our first round of residents and it went very well. And so we're looking forward to our next group. I don't think it's going to be this fall. I think our next group is going to be in the spring.
Thank you.
And shout out to YFIOB. Yay.
Krista, I see you dropped in the chat, Monterey County Health Department also. Oh, you also use Health Career Connect interns. That's great. And you work with CSUMB, MSW, and Hartnell College nursing programs to provide work-based learning opportunities. Awesome.
And just to throw out there, because we have run into a few where people they miss the DACA by now 1 year or 2 years because there was a cutoff. And so that's also potential very employable people that have degrees because they've gone through the UC system or the CSU system, and then they can't get a job after an internship. So I'd love to explore like how we can expand opportunities for them. And one thing that we've looked at maybe there would be a way to develop a co-op.
Okay. Anna is saying public health has a variety of training practicum efforts, CDPH pathway programs, MSN and RN preceptorships and clinical placements for Grand Canyon, Cabrillo, and CSU Stanislaus Schools of Nursing. Anybody else want to share? We can wrap up here on this topic unless anyone else wants to share anything in terms of work-based learning infrastructure that they have or are working on. Okay, quiet group today. Everybody's ready for lunch. Well, we'll go ahead and move on. We're going to wrap up very quickly here. Just a reminder, our next Health Workforce Council meeting is December 21st. It'll again be over Zoom, 11 to 12:30. We have a Zoom registration link, which we'll drop in the chat. And just a reminder, we're trying to keep track of all of our work in progress by uploading it to our website. So you can see our landscape report there. We'll upload our charter pretty soon. We have a list of our champions and who's working on our, who's championing our work groups. And all of that's on our website. And then next slide, Maria's going to share a little bit about the Zoom instructions. Although you guys are all here, which means you understood how to do the Zoom registration, but a quick review, because this helps us get 6 work groups up and running with monthly meetings and our quarterly Health Workforce Council meetings. So go ahead, Maria, and just walk people through this process that we've put together.
Thank you, Haley. Hi, good afternoon, everyone. My name is Maria Jerezano, and I am a program assistant with HIP. I assist and support Haley with efforts regarding the Health Workforce Council, as well as workforce development. So very quickly, I want to recap, the entire, just to make sure that the Workforce Council meetings are on your calendars and you're not missing them. So as always, clicking the link and making sure that it takes you straight to the registration portion of it, making sure that all of your information is correct, as well as your email, because you will get an email from Zoom shortly after you register. So just making sure that that's correct and updated. And then once you click on register, this is the main page that usually shows up, and underneath the times of our meeting times and the dates and the times and all of that, you'll see a small little section that says add to calendar. That is where you have the opportunity to add it either to your Google Calendar or Outlook or Yahoo, whichever it is that you use. Once you choose whichever calendar you want to download that the event to, whether you're using Google, Google Chrome, or Microsoft Edge, Safari, you'll receive a little download. Once you click on that download, it'll give you the option to either save the events directly onto your calendar, or it gives you the chance to import. And if that's the case, just import, and you'll have all of the events leading up to the end of this the Workforce Council on your calendar. And then shortly after, just make sure to check on your calendar to see that you have all of the meeting dates. And also shortly after that, you'll receive an email from Zoom with all of the meeting dates and a Zoom link, so that way you're not missing the following events and programs.
All right, thank you everybody for attending. We'll go ahead and close, give you back extra 10 minutes of your lunchtime. And we look forward to seeing you at our work groups if you're a participant in the work groups, and at our next Health Workforce Council meeting. If you have any questions, feel free to email me. And thanks again for joining us today.
Thanks, Haley.